Eldridge. I am Director of Financial Clearance, Patient Navigation at Moffitt Cancer Center. So what my team is primarily responsible for is new patient registration, financial clearance, and scheduling.
For someone outside healthcare, what does the journey look like for a newly diagnosed patient?
So the first step is for our team to gather their demographic information, as well as their insurance information and their diagnosis information. And then from there, we would step through the process of determining, is their diagnosis accepted here at Moffitt? Is it something that we can help them treat? We would verify that their insurance is active, or if they have no insurance, we would screen them for financial assistance. We would go through the steps of determining the most appropriate clinic for them to be seen in and provider for them to see within that clinic. And then from there, we would finalize their new patient appointment, get them scheduled.
For guided workflows, how did agents make those calls?
It was always difficult for the team prior to being able to rely on a tool like Zingtree. The issue was patients were being scheduled in the incorrect program or with the incorrect provider. We can't possibly provide enough information to these agents who are not clinical, right? They're not RNs, they're not APPs, they're not MDs, they're schedulers. We could not possibly provide them enough resources to make the correct decision 100% of the time. It would create delays in care, inconsistencies, and issues for patients. And then beyond that, there's an impact to the providers as well, because they're having a patient added to their schedule who they aren't really equipped to see, and it's taking up a slot for a patient who they are equipped to see. So there's kind of just this snowball effect, right?
I imagine you have a large patient access team. How do you keep consistent and accurate the entire team across so many different scenarios?
So we are building out countless clinical scenarios within Zingtree so that schedulers, the very large patient access team, just needs to get one answer at a time, either discussing it with the patient, discussing it with a referring provider, or finding it within a patient's most recent clinic note, for example.
Walk us through the work you're doing to set up variables and build reporting into the trees.
Yeah, so there are a few things, right? I would say one of the most important, at least early on, is seeing how many patients are flowing through the platform. And then of those patients, how many are being scheduled and how many are not being scheduled, right? And not due to errors or anything along those lines, but because, like I mentioned briefly earlier, there are scenarios where we just clinically cannot see a patient, right? It's more appropriate for them to be seen by a community provider. And if their case escalates in any way, for them to come back to Moffitt Cancer Center. So in the past, it's been very difficult up to this point, I should say, to be able to see that. We can see how many new patients are coming through our registration, financial clearance, and scheduling process, and say, out of 1,000, for example, we scheduled 800. But there's no visibility into why we didn't schedule the 200. And what we're trying to do is drill down and say, okay, yes, we can see this many patients flowed through Zingtree, and we determined based on our build that it wasn't appropriate for them to be seen in our clinic yet.
What does the scheduling workflow actually do for an agent handling a new patient?
What the use of Zingtree has allowed us to do is get very, very specific with how we're scheduling patients. So we are not only choosing the clinic, right, breast or GU or GI, we're choosing the specialty, medical oncology, radiation oncology, surgical oncology. And beyond that, we're choosing, should they be seen by an MD or can they be seen by an APP, right? And these are things that we never would have even imagined building into the process prior to having a tool like Zingtree, because it would require so much knowledge and effort from a scheduler to reach the appropriate resource.
What's changed for agents and for a team since the guided workflows came in?
I would say it most likely cuts down training time for a new hire from up to 4 or 5 weeks to maybe 2, right? And it really allows team members to not have to feel like they need to be a clinical expert when they clearly are not. I guess at an extreme, what you could say is with how complex our scheduling process is, and I'm sure many others are, especially at dedicated cancer centers, you could justify using RNs as schedulers because of how clinical it gets, right? And Zingtree basically allows you to avoid having to do that by providing a guided workflow. So you can bring a scheduler in who, of course, does not cost the same as an RN, but still can give the same impact as long as you build it out correctly in Zingtree and make it simple enough.
I know that Moffitt has looked at workflow automation and self-service options. Are there capabilities, maybe including AI-assisted ones, you're curious to explore down the road?
Yeah, we would love to, and this is something that we've been talking about for some time now, at least since we took the process back in February. Giving patients the option to kind of step through some of these questions themselves, maybe electronically on our website or through maybe like an AI voice agent guided flow.
In one sentence, how would you describe what Zingtree is to Moffitt today?
It allows us to schedule patients with the right provider the first time around, right? And that's my one sentence. If I could add sentences, it would be: you are saving patients trouble, you are saving providers trouble, you're saving the organization money. It's essentially a win-win, win-win-win, right? Everybody wins when you can use a product like Zingtree to get patients scheduled in the appropriate place the first time that you talk to them.